Good afternoon, everyone. Welcome to the press conference. The Chief Executive and officials will first speak before answering questions. Because of the COVID situation, please maintain social distance. Without further ado, we'll first hear from the Chief Executive. Good afternoon, friends from the media and members of the public. I and my team have called this press conference in relation to the latest situation of COVID-19. Today is a significant day. There is no local case today. In other words, for 14 days, there is no local cases in Hong Kong. For a road of 14 days, we have 0 infection. The last local case was the 7th of June. It's a related case to another one. It's a family of 3, so mother and daughters. That was the 7th of June. From that day to today, for 14 days, we don't have any local cases or related cases. In relation to the family of 3, at that time, everyone was worried because it involved a mutated strain. You will hear from Dr. Ronald Lam shortly. After this case, you may notice that the Hong Kong SAR government has done a large number of tests and tracing work. In relation to the place the family of 3 lives and the places the 3 of them have gone to, we have announced a number of a restriction testing declaration. We have tested over 30,000 people. We have not identified any positive cases. We have also traced 140 close contacts. They have been arranged to go to quarantine center. Apart from the elder sister and the mother, we have not identified any more positive cases. Under such circumstances, I feel relieved. In relation to prevention of imported cases, we'll continue to adopt vigorous yet precise approach to keep them at bay. Our measures are location-based. Based on their risk level, there are A, B, C, and D levels, and A1 and A2. A1 is very high, A2 A1 is extremely high, A2 is very high. C is medium risk, and D is low risk areas. In relation to these risk-based areas, we have adopted a number of measures. For extremely high-risk areas, flights cannot come to Hong Kong from these places. We also have a circuit breaker targeting imported cases with mutated strain. This is in relation to flight suspension. We also have vigorous test and hold and testing measures at the airport. We also have quarantine requirements of different durations. So we have adopted a very strict level in relation to prevention of imported cases. There are about 100 cases on the mainland since the end of May in Guangzhou, in Foshan, and Shenzhen. But there is no imported cases from Guangzhou. It shows that mainland authorities have done very well by adopting effective measures to prevent export of cases. They only allow people to enter the area, but not leaving the area. On the 12th of April, I introduced to you the new directions of prevention measures. There are 4 R's. We will not adopt across-the-board approach. We will give a chance for various trades to continue to operate. In relation to risk groups, we have adopted stringent measures. I ask you all to give us your full support. From the 12th of April to now, it's been over 2 months. In relation to our fight against the epidemic, I see that the majority of businesses have resumed to varying degrees. We see that all schools have started face-to-face classes. The DSE has been completed. There are some large-scale events, say Basel, bicycle international games, and the weekly races. They have all resumed. Some organizations have also started organizing seminars and talks. In relation to the resumption of business activities and flow of people, we see that there are good signs for our economic recovery. This is shown by our real-term GDP growth by 7.9% and an improving employment rate. The latest unemployment rate announced last week has dropped from 7.2%, which is a peak, to 6% for March to May. So now the situation has stabilized. We have to tell the public what the next stage is. As I said in April in relation to the new direction to fight the pandemic, we have the required capacities to do better. Should there be sporadic cases in the community, we have the capacity to control them and to stop community spread. In the 4th outbreak, we saw a number of clusters, say the gym cluster, the restaurant cluster. But compared to previous clusters like the dance cluster, you see the number of positive cases has significantly dropped. There was a case in Tuen Mun Yau Oi Estate. We have adopted vigorous contact tracing and large-scale testing. We have identified hidden cases to stop communities spreading. We noticed that there are overseas and local experts who said that COVID-19 will not completely disappear. Against this background, we have to seriously consider what steps should be taken to fight the pandemic. The business sector has asked to further relax restrictions so that they can expand the scope of their business activities. They say that currently the social distancing measures are too stringent. We can make adjustments, but of course, and it will be along the lines of relaxation. The effective date of newly announced measures will be this Thursday, the 24th of June at midnight. There will be a new round of social distancing measures. The new measures may not please everyone. Some people will still think that they are on the stringent side, but we do need to rely on an enhanced vaccination rate in order to have further relaxation. So far, we have 3.22 million doses administered. Those who have received the first dose account for 28.5% of our population. Normally, if you've had the first dose, you will naturally have the second one. So we have less than 30% of people who have immunity. It's been 4 months since the start of the vaccination program. We only have less than 30% compared to the mainland, Singapore, European countries, and Israel. Below 30% vaccination rate is not satisfactory. We will continue to appeal to the public so that you will get vaccinated. Is vaccination for all. I will defer now to Dr. Ronald Lam, the controller of the Center for Health Protection in relation to the COVID situation in Hong Kong and that in the world. It's been 2 weeks since we last had 4:30 press conference. So we will first hear from Dr. Lam.
Thank you, Chief Executive. Good afternoon, friends from the media. As at 00 this morning, the CHB has been investigating 3 confirmed cases of COVID-19, and these 3 cases are all imported cases, including 2 from the UK and 1 from Indonesia. However, the 3 cases have been tested positive for LC452R mutated strain, and up till now, with regard to the confirmed cases in Hong Kong, we have already got 11,887 cases, out of which 210 patients have passed away. And looking back at the past 2 weeks, that is the past fortnight, from the 8th of June to the 21st of June, the cumulative reports have reached 27 confirmed cases, and out of those 27 cases, all of them were imported cases. And we can see a trend from those imported cases. First of all, more and more cases have to do with mutated strains. And as I just said, for the 27 imported cases, 17 were related to the mutated strain, and out of those 17 cases, 8 were M501Y, and 9 were C452R. And we can also see the second trend. That is, apparently, if you look at the imported cases, apparently L452R cases are on the rise when compared to N501Y. The number of L452R cases become the main trend and is catching up. And therefore, looking at the situation with regard to the mutated strains, well, if you look at the situation as at the 20th of June, in total we have got 285 cases which have involved N501Y mutated strain, and for those with L452R case mutated strains, there were a total of 112. And as I said, we are investigating 3 cases, 2 from the UK, 1 from Indonesia, and we have seen that during the past 2 weeks, for those arriving from the UK, the so-called imported cases with L452R cases, that is during the past fortnight, we have already got a total of 4 such cases. And therefore, as you can see, such mutated strain has been spreading all over the world, and the number is on the rise. And globally, despite the fact that Hong Kong situation is relatively stable, but then when compared to the global situation is still very serious. If you look at the global figures, it has already exceeded 175 million infected cases. And just last week, we have already seen an increase by 2.6 million cases. And out of those, some 72,000 patients have died. And there are also some pressure points. And if you look at the mutated strains, well, for L452R, it has already spread to some 80 countries. And in passing, I'd also like to say something about the UK situation, because if you look at the passenger flow between the UK and Hong Kong is also on the high side. And if you look at the local cases in the UK, according to the health authorities, in fact, just yesterday, there were 9,280 cases of infection. And when compared to the previous week, that is from the 14th to the 20th of June, well, there were also some 65,588 mutated strain cases, and when compared to the previous week, it already went up by some 30%. For the newly added cases, over 99% of those were related to L452R mutated strain. And therefore, as you can see, well, today we are investigating 2 cases from the UK, and they both carried L452R mutated strain, and therefore I'd still like to call upon the public that we must we must keep our vigilance, because the global situation is still very acute. And if you look at the sharp rise in the UK in the number of cases, very often they are relatively young. So we're talking about the younger clusters, and many of them have not had the jab yet. And earlier on, for L452R cases, while they were spreading in the neighboring countries, we could see that they were also able to spread in places where the pandemic situation was less severe. And in those places, the vaccination rate was on the low side, and therefore, to step up prevention, well, in Hong Kong, while the situation is still relatively stable, we must think ahead so that we can take precautionary measures as soon as possible. Other than the fact that we have to call upon all the sectors to step up vaccination, what we are most concerned about is that for the elderly population in Hong Kong, the vaccination rate is on the low side. To give you an example, for example, for those over the age of 80, for those who have taken the first jab, if you look at this age group, it's only at about 4.6%. But then, for those who have taken both jabs, that is, those who have completed the vaccination, for those from the age group of over 80, it's only at 3.5%. And therefore, you can imagine, well, we are faced with such pressure that there might be more imported cases. And once it spreads in the community, then that age group will be at high risk. In particular, for the 210 cases of death because of COVID-19, in fact, for those over the age of 65, the mortality rate was over 88%. So from that, you can see that we have to step up our efforts. There is no room for complacency. And there have been some misunderstanding. That is, some people would think that for the elders and for those with chronic diseases, they would have to be extra worried. But then, as our scientific committee and also the expert panel to the CE have recommended that so long as that particular elder or that patient with chronic illnesses, if he is suitable for taking the jab, then he can take the jab safely. And therefore, I hope that this message can be sent out to the community. Finally, I'd like to remind all of you that please remember, that is, other than taking the vaccination as soon as possible and also washing your hands frequently and also reducing your contacts and keeping social distances and so on, these are the things that we have to do and remember. Thank you.
Thank you, Dr. Lam. The adjustments to social distancing measures to be announced by myself and Professor Chen, as we have done previously, it will be done on the basis of vaccine bubbles. We ask people to get vaccinated. We want to adopt a more targeted approach. So we will make decisions based on risk levels of the various social activities and business activities. For an activity that involves eating and drinking, when you have to take off your mask and you have close contact with people around you, say for example your friends and waiters come as opposed to another activity such as a conference or a concert. There are different risk levels involved, and these are our considerations. Another factor we will take into consideration is, say for example, is an event involving an organizer. We will gauge the ability of the organizer to impose and implement these measures. Say for example, one organizer will issue invitations and require all participants to get vaccinated. The risk level involved will be different from another organizer that have less control. There are three major groups under our social distancing measures. The first one will remain unchanged. They are public bathhouses. Well, they've been allowed to operate, so that won't change. And in relation to cinema, there will be a seating capacity of 75%. They won't change either. The other category are premises that will see a relaxation. We will not impose additional requirements. The restrictions will be relaxed without additional requirements, as I said. The other category is based on a vaccine bubble. If people involved have been vaccinated, then they will see further relaxation. I will now defer to Secretary for Food and Health, Professor Sophia Chan, to announce in arrangements in relation to 599F, that is in relation to business and premises. The COVID situation in Hong Kong is getting more stabilized, but as you've heard from Dr. Lam, there is still a risk of importation of cases because the situation outside Hong Kong is still serious. So we have to remain vigilant. We are aware that there are local voices asking for a resumption of normal activities. As the chief executive said, we will, based on a vaccine bubble, relax certain measures. We will issue a press release in relation to the details. I will go over the salient points now. In relation to catering business, we will keep the four mode of operation types A, B, C, and D. Type A will remain unchanged. For type C, the capacity will change from 50% to 75%. In order to encourage more catering businesses to adopt type D of mode of operation, if all their staff members have received 2 doses of vaccination plus 14 days, the capacity of the premises will be adjusted from 75% to 100%. The number of people per table will be relaxed to 12. For a banquet, the limit will be relaxed to 180. In relation to vaccination requirements of customers, it will change from 100% first dose to 2/3 of the number of people per table or the total number of guests in a banquet, because we're aware that there will be people, because of health reasons, unable to get vaccinated, and there will be children. In relation to the unchanged requirements of vaccination of customers and staff members for bars and nightclubs, the number of people per table will be relaxed to 4 per table. In relation to karaoke, the number of people per table will be relaxed to 8. In relation to mahjong tingkao places, there will be a similar relaxation to the number of people per table. We will also provide another mode of operation. For the five types of premises I've mentioned, for staff members who have received both doses plus 14 days, the restrictions will be further relaxed in terms of the number of customers per table or per room, as well as the business hours. That is in relation to staff members who have received 2 doses of vaccination plus 14 days. The operation of bathhouses will remain unchanged. In relation to public and private swimming pools, the capacity will be relaxed to 50%. If customers and staff members have been vaccinated, individual swimming pools will be able to further increase their capacity. In relation to scheduled premises and live performances, for the performers, if they have received the first dose and abide by relevant requirements, say for example, keep their masks on as far as possible during the performance. And for performers in a theme park, for outdoor performance, if they have received 2 doses, then they don't have to wear a mask. In relation to gyms, if all members in a training group in the room, including coach, students, as well as staff members, if they have completed the vaccination and if they maintain sufficient distance between people, then they don't need to wear a mask when they are working out. For small group coaches, if he cannot get vaccinated for health reasons, then the coach or the instructor will have to wear a mask. These requirements apply to relevant facilities in other places. These measures will come into effect from the 24th of June to the 7th of July. We will continue to enforce the law. We will ensure that operators and members of the public will abide by all the requirements. We have altogether inspected catering premises and scheduled premises 98,000 times and 35,000 times. We have initiated 126 and 68 prosecutions in relation to requirements of prohibition of group gathering and requirements of masks. Law enforcement agencies have inspected 110,000 times and issued close to 2,000 fixed penalty tickets. We've also initiated 46 prosecutions. I must emphasize that, taking reference of international practice, there will not be an across-the-board relaxation of social distancing measures, because that will attract a rebound. So we'll make use of the vaccination bubble as a basis, because it's scientifically backed and recognized internationally. We will ask people who are not being vaccinated to get vaccinated.
If you'd like to get more details, the relevant departments will be issuing press releases on this to give you more details. Next, I'd like to turn to gatherings, because this is about another piece of legislation that is under 599G. So it's about gatherings. Well, under 599G, for the 4-person limit, it will continue. But then, as I said, based on several reasons, some of these gatherings capacity or limit can be relaxed appropriately, so long as those participating continue to wear their face masks. Previously, we did not consider requiring them to take the jab, but then given the fact that some 30% of the population have been vaccinated, and therefore we can introduce the idea of this vaccination bubble to these gatherings. So the so-called requirement for taking the vaccine, well, it would apply to category D. So we are not saying that 100% of those participants have to be vaccinated, because that may not be feasible for various reasons. Not all of those participants would be able to take the jab, and therefore we would be prepared to appropriately relax the requirement, so that so long as 2/3 of those taking part in such activities have been vaccinated, and if they have already taken the first jab, then they would be qualified. So first, it's about religious gatherings, because we have heard many religious groups say that, well, it's only 30% of the capacity of the premises, and many religious or churchgoers would not be able to go as a result of that. And we are prepared to relax that to 50%, but then if they are able to meet the requirement that I said, that is 2/3 of the participants have already taken the first jab, then we can relax it to 100%. So basically, it's back to normal. Second, where premises do not supply food and wedding banquets and so on, well, the current capacity limit is 20 people. Because generally speaking, if you have a wedding ceremony, there would be a hall and some special room for that. So generally speaking, the general rule would be 50%. But then, if all the guests, including the bride and groom, if 2/3 of them have already been vaccinated, then we can relax it to 100%. And for commercial activities, for example, for AGMs, EGMs, the same rule would apply. Well, right now, only 20 people will be allowed to join, and without further requirement, we can relax that to 50%. And if 2/3 of those participating in such general meetings have been vaccinated, then we can relax it to 100%. And for two groups, the current capacity limit is 30. And if they are able to meet the requirement of having 2/3 of the tour participants having been vaccinated, then we can relax it to 100. And because of July the 1st coming in, and also there are also some seminars on the Greater Bay Area and so on, so we'll make it clear that is in hotels or the convention and exhibition center, in the bigger halls and banquet halls and so on, if everybody has their mask on, and if there is no food supply, then we can relax it to 100%. As I said, the details will also be published in the form of press releases. Next is about the immigration control. Well, as you might have noticed, recently the EU has already issued this notice that they can relax the rules, including those who are from non-European Union countries. They can also have those rules relaxed, and individual countries would also set certain limits. For example, in France, you will have to be vaccinated before you are allowed to enter, and you would also have to take the designated types of vaccine before you would be allowed to go there. And there is no need that you have to fulfill certain compelling requirements. And other countries would also be making the announcements shortly. And given the fact that Hong Kong's situation is relatively stable, I think internationally speaking, our situation has been quite satisfactory, and it's time for us to appropriately reopen our border, in particular for places where the situation is very similar to our cases. And in particular, many Hong Kong people have already taken the jab, and there is also a need for them to go to other countries, either to visit their friends and relatives, or for sightseeing purposes, or for other reasons. Well, when they go, it's okay. But then when they come back to Hong Kong, so they are like somebody coming into Hong Kong, and they might also be subject to the 14-day or 21-day quarantine, and that would also kind of bother them. And therefore, the measures that we are announcing today would also take into account the fact that there might be Hong Kong residents going out, and then they would also have to come back to Hong Kong. And was on the 9th of June, there was a joint scientific experts committee, and they had a meeting, and they have also given an account on their consideration. Indeed, they are also of the view that there is room for relaxation because many people have already taken the jab, and globally, many people have been vaccinated already. And therefore, there would be this recommendation that an additional test be done to check the antibodies. In other words, once this person has been found to have certain antibodies after they have taken the jab, then so they are suggesting that so long as you can meet 3 conditions, then the quarantine period can be reduced to 7 days. And they are already being applied. First, you will have to complete the vaccination. That is, you have to complete the vaccination, and it's already for more than 14 days. And also, you will also have to have the test at the airport. And then you will also have to go to the designated hotel. And thirdly, after arriving in Hong Kong, the experts do not agree, and they would not accept that. After they have left their home country, and before they arrive in Hong Kong, they should be subject to the antibody test. That is, as soon as they have arrived in Hong Kong, they will have to take the antibody check or antibody test. The technical name is quite long, and if the test result is positive, in other words, they have already got antibodies, then the quarantine requirement can be shortened to 7 days. And for such antibody test, is very effective. There is a validity period, and they would suggest that it should be valid for 3 months. And therefore, according to the Joint Scientific Committee's recommendation, we are announcing that we will adopt a 2-phased approach. That is for arrivals in Hong Kong. We are talking about people coming from outside of Hong Kong, not including those from mainland China and Macau. So for those arriving in Hong Kong from other countries, for the mandatory quarantine period, there will be 2 stages whereby they can be shortened to 7 days. And for these arrivals, number 1, they will have to complete their vaccination for more than 14 days. And second, they would also have to take the test at the airport, that is the so-called test and hold. And third, they would also have to undergo this antibody test, and it has to be positive. Because, as I said, for the first stage, it would apply to Hong Kong residents. In other words, for Hong Kong residents who have completed the vaccination, just tomorrow, they can go to a recognized lab or private hospital to do this antibody test to prove that he is positive, and then he'll be allowed out. And then by the time when he comes back, that is, say, within 3 months, if they are able to show that they've already got this antibody test, which is positive, then there is no need for him to undergo this 14 or 21-day quarantine. So long as he can stay in a hotel for 7 days, it's okay. And we would also have to take time to arrange for that, because we will have to make sure that there is a proper place for him to undergo the test. Should it be done at a laboratory or at a hospital or whatever? So we will have to arrange for that. So for the second stage, it would apply to arrivals from overseas countries. In other words, they are not Hong Kong residents, and they have already completed the vaccination, and they have also undergone the test at the airport, and they would also have to provide an antibody test which is positive, and then normally they would only be subject to a 7-day quarantine period. And as I said, we are still working on the detailed arrangements, but then we can see that basically that will be the arrangement. So for the arrival, he will have to do the test at the airport, and normally he would also have to wait for a couple of hours, and we will arrange for healthcare professionals. Normally they would be nurses from the laboratory, so they would also have their blood taken at the airport, but then most likely we would not be able to give them the result right away. So we will have to do the test at the laboratory, and therefore for this arrival, upon completing the virus or the test at the airport, and then if it's negative, then he will go to the hotel to wait for the result of the antibody test, and then the following day we would be able to tell them that your antibody test has been positive, and therefore there is no need for you to stay here for 14 or 21 days, and you can leave after the 7th day. But then during that period, he might have to take another test, so we will have to work out the details.
The first stage, I reckon, will be launched at the end of this month, the 30th of June, for Hong Kong residents leaving Hong Kong. Hong Kong residents who have received both doses and they have been tested for positive result for antibodies. We hope that the next stage will be implemented in a month's time. Now I move on to the arrangements with the Mainland and Macau. We have officially started discussion with the Macau SAR government in relation to travel or flow of people. We have met the requirement of a 14-day zero infection. The scheme will have a quota because boundary control points will need to have the capacity to handle the amount of people coming. There won't be any more e-channel. We will start with a small number in the quota before expanding. A basic requirement will be a completion of the vaccination course. Thirdly, there will be testing for the virus when they leave and when they arrive. And fourthly, there will be a circuit breaker. Under certain circumstances, the opening at the border between Hong Kong and Macau will close. Well, were it not for the fact that there were cases in Guangzhou at the end of April, we would have launched the Come to Hong Kong scheme for people from Guangdong province to come to Hong Kong. But we will now wait for the COVID situation to stabilize in Guangdong province first. We will have to discuss with the central authorities. I will submit our proposal as soon as possible for their consideration to decide how flow of people across the border can be resumed upon meeting certain conditions, say, for example, testing requirement. We do understand that for people from Hong Kong, they need to go back to China to work, to inspect their factories, to see their relatives. We will try to do it as soon as we can. Once we have the details, we will make an announcement. Mr. Nip is here. If you have any questions in relation to vaccination, Patrick will be happy to answer. Now the floor is open. Raise your hand, wait till you're given the microphone, identify yourself and your organization before you start. Please keep your number of questions to below 2, and if you have other questions not related to the epidemic, please save them till tomorrow. I'm from cable TV. First of all, I'd like to ask about 14 days zero local cases. You describe it as stable. How come the restriction of group gathering is not changed? It's still kept to 2, but there are relaxations in relation to celebrations for the 1st of July. Does it mean that you don't want to see any marches or protests? Will you use vaccination as an incentive? In relation to relaxation of measures or karaoke and bars, how do you ensure that these premises will not break the rules, and how to ensure that all patrons are vaccinated? There has been press reports about certain breaches. So how do you guarantee that everything will be done properly? In relation to the quota with Macau, what will be the number under the quota? Would there be a timetable for Come to Hong Kong scheme? For the Come to Hong Kong scheme's timetable, it depends on the situation in Guangdong. As we've said, that under the scheme, it only applies to non-Hong Kong residents in Guangdong province. There may be cases in Guangdong province But the return to Hong Kong scheme has not stopped. In the past month, in neighboring areas, Guangzhou, Shenzhen, Dongguan, Foshan, there are cases, but none of them came to Hong Kong from Guangdong province. At the same time, there are people coming to Hong Kong under the Return to Hong Kong scheme. As you know, that there are stringent measures in a localized area in Guangdong province to stop the cases from leaving. I hope that the Come to Hong Kong scheme will be launched as soon as possible. We don't have a timetable for the arrangements with Macau because it's a bilateral discussion. The message we have is that it doesn't have to peg with Come to Hong Kong scheme. It can be a separate arrangement between Hong Kong and Macau. The original idea of Come to Hong Kong scheme will include Macau, but now we understand that we don't have to wait for the finalizing of Come to Hong Kong scheme to cover Macau. It is left for the Hong Kong SAR government and the Macau SAR government to work it out. In relation to 599G, the prohibition of group gathering, as I've said, in relation to the latest round of social distancing measures, including gathering, we have to consider the vaccination rate, the transmission risk brought by the activity, and the capacity of the organizer or venue owner of the event, whether they are able to meet all the requirements imposed on them. We have considered all these factors and we have relaxed appropriately the measures of certain premises. In relation to law enforcement, the reporter mentioned about karaoke and bars. Regarding 599F, the scheduled premises, there are a number of requirements. Say, taking of temperature, requirement of mask wearing. The other type of requirements or restrictions are in relation to seating capacity, say 50% or 70%. Another aspect of our restrictions are related to the number of people per table or per room. We have been carrying out law enforcement actions. I'll defer to the Permanent Secretary in relation to our law enforcement situation. For premises that are type D, that means staff members and patrons will have to be vaccinated and use the Leave Home Safe app. The FEHD and the police have mounted joint operations from time to time. Checks have been made on the vaccination record of staff members and patrons. The Innovation and Technology Bureau has made sure that you can access your vaccination record using the Leave Home Safe app. So law enforcement officers will be able to readily check that. And as I've said, patrons will have to use the Leave Home Safe app, and that can be checked as well. I will defer to Ms. Vivian Lau, the Permanent Secretary, about the enforcement situation. To ensure that scheduled premises, say for example bars, karaoke, that they have met all the requirements, we will first make sure that these premises are aware of the current requirement. The FEHD themselves, and sometimes with the police, have mounted operations to check. Over the last weekend, Friday to Sunday, the two departments have mounted a joint operation by inspecting over 40 catering businesses, including bars and pubs, and 38 other premises, and that also covers karaoke. We found that there are some karaoke establishments and clubs, nightclubs, that have not made sure that all staff members and patrons have received the first dose of vaccination. As required. The person in charge have been prosecuted. At the same time, there is an administrative measure. If the nature of the breach is more serious, that is, failure to get all patrons and staff members to receive the first dose of vaccination, starting from the first day of the breach, we have put in place measures to reduce the risk of infection by requiring them to close for 14 days. In other words, they will have to stop operating immediately for 14 days. Well, we have done more. Some patrons are unable to produce proof that they have received the first dose of vaccination. They are deemed to have not met the requirement. The FEHD has issued fixed penalty tickets amounting to $5,000 to these customers. If you plan to go to karaoke or bars, please make sure that you meet all the requirements.
Next question, please. The person in grey in the second row. Good afternoon. I'm from Oriental Daily. So with regard to reopening the border with the mainland, so what progress has been made? Just now you said that in light of the pandemic situation in Guangdong, you have only partially reopened. So what about the other places? What are the considerations? And also with regard to the circuit breaker with Macau, what are the criteria? So will you be making reference to the travel bubble with Singapore? So can you announce further details? And also with regard to the second category, that is about the antibody test, so that for non-resident of Hong Kong, after his arrival, he will also have to take the antibody test. So what arrangements will be put in place? So instead of being quarantined for 7 days, he may have to be quarantined for 14 days. And also, what about the contractors and operators? Where can they take the test? So can you tell us more about that? Okay, 3 questions. First, all along, on different occasions and through different means, we have been liaising with mainland authorities, including the central authorities through the Hong Kong and Macau Affairs Office, and also we have been talking to Shenzhen government and mainland governments about the reopening of the border arrangements. Well, since the fourth wave that is in November last year, before the outbreak of the fourth wave, we have already discussed the detailed arrangements. I've also talked to the provincial governor, Mr. Ma, about the arrangements. Of course, there would be prerequisites and there would also be requirements and also quota. But then because of the fourth wave outbreak, that didn't come into being. But then we have now got more experience. Even if there were 1 or 2 isolated cases, we would still be able to prevent a major outbreak, and therefore we should have greater confidence in restarting those negotiations. But then I don't have any details to announce today, but then the only thing that I know is when it comes to revival of our economy and also the cross-boundary needs of our residents, we have to make sure that we can return to some normality in terms of reopening the border. We may not be able to return 100% to normal. So basically, we may not require the 14 plus 7 day quarantine arrangement. But then with regard to Macau, well, I'm not in a position to announce the details, but then normally we would still have the circuit breaker if there is an increase in the number of cases, and we are talking about a daily average, and also whether or not there are connected cases and so on. We may have to invoke the circuit breaker, like what we did with Singapore. Well, there should be such a circuit breaker, but then before we reach an agreement, it's not for me to disclose all the details here. And we will still have to spend more time to work out the details about the taking of the test. But then you are very careful because of our non-resident who has had both jabs, and he thinks that is okay, and he would think that 7-day quarantine would be enough. But then what if he doesn't show up with the antibodies, and if he has booked a hotel for 14 days or 21 days without knowing whether or not he has the antibodies, then what is going to happen? So we will make sure that the Tourism Commissioner would have to talk to the hotels in order to tie in with the SAR government's policy. They would have to have greater flexibility in dealing with such hotel bookings. In other words, there is a chance that this particular non-Hong Kong resident, upon arrival in Hong Kong, after he has completed his vaccination, and let's say if he comes from a category B place, all right, if he has taken the jab, then he would have to be quarantined for 14 days. But then if he is willing to take the antibody test, and if it's positive, then his quarantine will be reduced to 7 days. But then since he hasn't arrived in Hong Kong, he hasn't taken the test, then definitely he will have to book the hotel for 14 days, right? But then upon arrival on the second day at the hotel, if we inform him that, okay, you only need to be quarantined for 7 days instead of 14 days, then does it mean that he will still have to pay the additional 7-day stay for his hotel booking? Well, probably it might not be necessary if there are more people coming to Hong Kong to engage in commercial activities. We don't want to make their lives difficult, and I think there is a high chance that we might be able to strike that deal with the hotels. With regard to who can take this antibody test, we will definitely be making the announcement shortly, because we do have the system in place at the hospitals and at certain laboratories. You can take the test, but then they will have to be certified by the Department of Health, so that they are authorized to conduct the test, which will be recognized by the SAR government. We will be making the announcement shortly. Sorry, speaker's not coming through. He is not speaking with a mic. You can see it has not been approved, but it doesn't mean that negotiations have not taken place. We haven't reached that stage to be in a position to make the announcement. During the past 6 months or so, we have been negotiating on that as to when, where, and how. As you said, there have been no progress whatsoever, because as you can see, at the Shenzhen border or boundary crossing, we have to abide by the rule of 14 plus 7, and even if you go to Beijing today, you will have to be quarantined for 14 plus 7 days. So we haven't reached a stage whereby both sides are assured that we can be rest assured that cross-border traveling should not be subject to any regulation, because we have to prevent the imported cases from coming in. Because if you allow everybody in, then that's very difficult to fight the pandemic. Next question, please. On the left-hand side, the lady with a ponytail.
From RTHK English News. First, when authorities are talking about testing the antibody levels for incoming travelers who are vaccinated, what kind of measures do you suggest hotels to do to kind of give more flexibility to tourists who are making booking at the hotels? And a Hong Kong study actually found that antibody tests may fail to pick up...
Sorry, can you speak slowly? Because wearing a mask is very difficult.
Sure. I will repeat my question. First, when you're talking about testing the antibody for incoming tourists who are vaccinated, what kind of what kind of measures can hotels provide for tourists so that they can have the flexibility in arranging the hotel's bookings? And HKU's study actually found that the antibody test may fail to pick up some small amount of antibodies generated by the Sinovac jab. So do authorities have this threshold of amount of antibodies that travelers have to have in order to qualify for this shorter quarantine? Second question, we can see that some relaxations is happening to certain establishments without added requirements, for example, the vaccination requirement. Would that send out a wrong message to the public, basically saying that, oh, the easing of social distancing measures may come as long as people wait long enough and they may not have to be vaccinated? Third question, can you explain the rationale that a group of 4 people can attend a wedding or event celebrating the handover without any problems, but once they head out to the street, they may be found to be violating the social gathering ban of 4 people and more? And does this discrepancy kind of happen because authorities do not want protests to happen? Because protesters can still wear masks, and protest organizers can also help to make sure that infection control measures have been carried out. Thank you.
Well, first of all, based on what we were advised by the joint scientific group earlier this month, we are now introducing an arrangement which will provide more convenience for the resumption, for travelers to resume coming to Hong Kong. It works on the basis of antibody tests, which I understand is quite unusual up to now all over the world. But since our experts have given this view, and antibody test does confirm that the vaccine has had its effect. So what we will be doing is for arrivals into Hong Kong, if that particular passenger is willing to take an antibody test and the antibody test is positive, which means that he or she has antibodies, then the mandatory quarantine period at the designated hotel could be reduced from 14 days to 7 days. I believe this will be much welcomed by a lot of business travelers coming to Hong Kong. Now, your specific question is how hotel could facilitate this sort of arrangement. Because according to the joint scientific group's advice, they would rather prefer the antibody test to be taken in Hong Kong. Whereas sometimes for the COVID-19 test, we could accept pre-boarding certification, although now it's also test and hold at the Hong Kong International Airport. So in order for that fully vaccinated passenger to take an antibody test in Hong Kong, inevitably he or she will have to stay in a hotel for a while waiting for the antibody test. So that would mean that that passenger has to book on the basis of a longer period of quarantine, say 14 days. But if he or she is being advised maybe on second day or the third day that, oh, your antibody test is positive, so you could actually leave the designated hotel earlier, a week earlier, then I would very much appeal to the Hong Kong hotels that they should allow that flexibility for the passengers instead of charging them for the full 14 days. I have already asked the Tourism Commissioner to start these negotiations with the hotel sector. Because at the end of the day, we want Hong Kong to become, again, a very welcoming place. So why do hotels want to make life difficult for our visitors and travelers and business people by asking for the 7-day charge instead of helping the government to facilitate implementation of this measure? So I'm pretty optimistic that we should be able to work out that facilitation arrangement. Now, what will be the threshold for the antibody is not for me to answer. This is a scientific question. But it happens that I have gone through an antibody test and I'm positive. I did raise that question with my doctor and I was given a figure. And I took Sinovac, as you know, and I was told that it would be very, very adequate. So it's not a very mechanical exercise that you have to reach a certain number. As far as I was told by my doctor, who is a professor at the Hong Kong University, he said that this would be far more adequate than you need, actually. So I can only tell you that if you want more scientific response, I will have to ask my experts to give you an advice later on. Now, the third question is about I think you are right in that observation. But having been through this COVID-19 for 18 months, and the fourth wave had lasted for half a year, and people are urging for more social activities. Business are crying for more business turnover. If we rigidly stick to, no, now the first objective is push for vaccine, so everything could only happen when you are fully vaccinated. I think that is not being very responsive or very compassionate to the sentiment. So I still appeal, and we will still facilitate the taking of vaccine by people who want to take it. But the time has come for us to allow a higher level of business and social activities without being made subject to vaccination. But of course, as you will notice, that if the business and the participants are willing to take the vaccine, the relaxation will be much higher. It's 50% to 100% of the capacity, okay? So I hope that still is a good enough incentive to appeal and encourage people to take the vaccine. Now, the final question is about CAP 599G. We are not discriminating or penalizing a particular type of activity. After all, Hong Kong is a very free society, and the freedom of expression, freedom of protest are being honored under the basic law. But we are dealing with a public health pandemic that is still hitting the world. Now, in dealing with the public health, of course, the first factor we need to consider is the infection risks. What is the inherent infection risk in a particular type of gathering? The second we have to take into account is the ability to manage the risk. So if we ask people to wear the mask, to take a temperature, now to check whether you have a vaccination record and so on, you need somebody who has that capability to assure us that, yes, that venue or that event organizer is capable of fulfilling that requirement. So basically, what we are now proposing is venue-based relaxation. So it has to take place in a venue. So it is within a confined area that the more relaxed measures will be applied. It's certainly not to prohibit a certain activity which has nothing to do with public health. Everything is based on public health, having balanced the factors that I have referred to. Thank you.
Just want to know, any more English question? Gentleman here, please.
Thanks. It's James with Transit Jam. Two questions. Firstly, with children under 12 or infants will still have to do 3 weeks. So obviously there's scientific reasons not to let them out into the wild, but what's the administration's latest thinking on this issue, and do you have any thoughts on that? Excuse me. And second question, if I can change the subject, you gave a speech this morning at the World Cities Forum about sustainable transport.
Sorry, we will focus on COVID today.
Okay, apologies. One question only. Thank you.
Thank you very much.
This is one of the fine details that we have to examine and come to a position. That's why I said that we are not yet able to announce a firm date for the implementation of this new arrangement of bringing down the quarantine period to 7 days for those who have been fully vaccinated and who are willing to take the antibody test. So thank you for raising this. If the arrival is a family and has within a family either a young child who could not be vaccinated or an elderly person who is medically unfit, then how are we going to deal with that family situation? We will study that and come up with a response.
下一條提問，我哋 It's
Next question. The report in the shirt. Good afternoon, CE. The business sector has launched a number of award measures to encourage vaccination. But there is still a gap from a proper immunity barrier. How will the government boost vaccination to build the protective barrier, and would there be incentives and award schemes from the government? As I have said, we have a sufficient supply of vaccine, and we have convenient venues and measures for people to get vaccinated. Currently, the vaccination rate is only 28.5% in relation to the first dose. That is not ideal. Normally, we talk about a 70% of vaccination in order to build a sufficient protective barrier. You can see that it is still quite some way to reach that level. The highest number of doses administered per day is about 30,000 or so. On the 31st of May, when I announced the Vaccination for All campaign, I was thinking about 40,000 doses administered a day. Mr. Nip, well, you will have to get your first dose before the end of August, before we can get 70%. Regrettably, we only have an average number of about 10,000 or 20,000 doses administered a day. And we also need to look at the figures for the second dose. You ask what we can do. What we can do is to encourage members of the public to do it. Say, for example, if you want to have a bigger wedding, then you encourage your guests to get vaccinated. If there is 100% vaccination, or 2/3 of your guests have been vaccinated, then you can have a higher capacity. As I said last week, from the business sector, well, the amount of award given out by the business sector is over 200 million in dollar value. I think that we need more people to get vaccinated in order to bring our community up to a safe level. We have used the level of 2/3. You have seen something similar previously. This diagram is from the Jockey Club College of Vet Medicine and Life Sciences of the City University. The dean of the faculty is someone from Germany. A couple of weeks ago, he has given us a presentation, and I have spoken to him personally. Well, you can easily understand the idea. The figures in blue are those who are vaccinated. Those in gray are currently healthy but not vaccinated, and the figures in red are those who have infected. And if there are a few number of people in blue, then there will be high transmission. In a different scenario, if the person who have the virus is surrounded by people who have been vaccinated, then other people will be safe because the infected person is practically cordoned off by those who have been vaccinated. We hope that 70% of our population will become figures in blue, that is, vaccinated, then we will be able to contain the spread and keep Hong Kong safe should there be an imported case in our community. In this case, then people can continue to go to school, go to work, engage in social activities, and businesses can continue their operation. Vaccines is not manufactured or invented by the government. For the sake of your family and your friends, we need to work harder. We need to seize the opportunity of the good signs of economic recovery. Please get vaccinated. And if we need further facilitating measures, I'm sure that Mr. Nip will be more than happy to bring up some more ideas to make that happen.
I can supplement, other than the fact that we have sufficient vaccines and also very convenient locations for you to take the vaccine. As the Chief Executive said, in order to allow life to return to normalcy and also to prevent the spread of the virus in a community, vaccination is a very important thing. Secondly, we also have different ways and channels. For example, we have the outreaching services so that at your workplace, we can also provide the vaccination service. So we have already arranged for vaccination teams, and they've already done 12 such vaccination events. So some 2,900 people have been vaccinated so far. So after the colleagues have taken the vaccine, their peers can also see that, and they would also be motivated to take the jab. So we have already done some 3 million jabs, and worldwide, some 1.2 billion people have taken the jab. So in terms of the efficacy and safety of the vaccination, it's already proven. Yes, for individuals who are worried about taking the jab, in particular the elders, well, as the experts have said, well, if they are able to take the flu jab, then taking the COVID-19 jab should not be a problem at all. But then if you're still worried, then as the hospital authority has announced, they have already put in place for some time slots for consultation, so you can make arrangements and bookings with the GOPD so that you can consult a doctor before you take the jab. And they will also increase the number of clinics from 15 to 21 so that they would also facilitate vaccination. And then for schools, we have already started to lower the age group from to 12 to 16, so that starting from today, some schools have arranged for the students, teachers, and parents to take the jab at the vaccination centers. So this is one of the ways to do it. And starting from next week, we would also have some outreaching services to allow for students to take the jab at schools. So this is the facilitation that we have put in place, and in the end, it's the individual's choice to decide if they like to take the jab or not. So we'd like to mobilize the entire community, and of course, we would provide incentives and encouragement for everybody to take the jab, and that's what we are going to do. Last question today. The one with long hair. Yes, I'm from Now TV. I'd like to know that for Category D eateries, some 1/3 of the capacity, 60 people can eat together within the same premises. How come? Well, on the street, only 4 people would be permitted to group together. So was it a decision taken by you, Mrs. Lam, or by the experts? And also for the risk-based assessment, what is that about? So for the 17-year-old young girl who has this mutated strain, so have you compared the sequencing with Taiwan's cases and so on? Yes, Dr. Lam. Yes, thank you. With regard to the 17-year-old girl, so case number 11852, as you know, is a family cluster. So mother and 2 daughters were infected. So initially, it was the 17-year-old daughter who was infected. So the other cases were 11859 and 11860. So there were 2 things that we did. First, we tried to do contact tracing. And second, we prevented the virus from spreading further in the community. And then for contact tracing, we tried to trace all the close contacts. and we conducted tests. So 143 people were tested. And if you look at the PCR tests for the 143 people, they've been tested negative so far. And then over 70 people were also required to undergo the antibody test, and it's all negative. So out of the 143, 13 were vaccinated already, other than the PCR tests being negative. Their antibodies have also shown to be positive after the vaccination, and therefore, as far as close contacts are concerned, we haven't found any source of that infection. That's the first point. Secondly, well, as the chief executive said just now, on this particular case, we have done a large number of mandatory testing, and the number of places involved some 31 premises. And we did just do it once, we did several times. And therefore, whoever was related to the case was tested and tested repeatedly, and all of them have been tested negative. And thirdly, we also went to some of the more important cases to conduct epidemiological or pathological investigation. For example, the premises where she worked, or she did this private tutorials, and also she went to certain premises, and all those places were investigated. She'd been to many places, and we took samples of those places to conduct the assessment. For example, she'd been to the pet shop, and the pet animals there, for example, the cages where they were put in. So there were over 40 of those cages, and we took samples of them, and they were all tested negative. And within her home, we also took some 15 samples. And as we announced, there was this package of crocodile meat, frozen meat in the fridge that was found to be positive. And there were some 90 samples taken from her home environment, and they were all tested negative. None of the samples has been tested positive, and according to the family member, probably the crocodile meat were placed in that freezer for over a year already. So it's not that the crocodile meat has infected her. On the contrary, it must have been that when she took out something from the freezer, she contaminated the crocodile meat pack. And also, at the premises where she took her private tutorials, some samples were also taken, and they were all found to be negative. So there were 3 directions to take. If it's human-to-human transmission, then overall speaking, for the close contacts and also their family members who have undergone mandatory testing, and they have all been found to be negative, and therefore we haven't been able to identify any person who has been infected. And also for pet animals, was it possible that there was this cross-species transmission? But then as we have taken samples from these pet animals, including the cage where the patient kept her pet, well, it was also tested negative. And thirdly, it's quite rare. But then we also consider that. So was it possible that it could have been transmitted from the meat pack to the individual? Because as we said, we found that on the surface of that pack there was this virus, but then subsequently we were of the view that she might have contaminated the surface of the package instead of the package transmitting the virus to her. And thanks to the health authorities of the Guangdong, well, for the N501Y cluster in Shenzhen, we also got the sequencing of the virus there, and also from Taiwan, there was also an outbreak of the N501Y strain, and thanks to their authorities, they've also sent us 4 different strains so that we can make a comparison. And as we said, when compared to that family cluster, it's not very similar. And finally, we also went to the global genetic sequencing database to do a comparison, and we compared that, and that was done by the Hong Kong U, the Poly U, and also the Public Health Committee, and also the Public Health Laboratory also went to the global database to make that comparison. We couldn't find any common source, and therefore what we can say for the time being is during the 14-day period, given our close vigilance, we haven't been able to identify another person who has been infected. And secondly, we haven't been able to find a very clear source where we can identify to be the source of infection. And as I said, for the upcoming threat, definitely is the import of the mutated strain. And therefore, if the vaccination rate is still not high, then it could be that we can have an outbreak in places where they did not have this spread.
第一個問題
To answer your first question, in the past 18 months of our fight against the pandemic, I and my team face a great challenge. We have to constantly make decisions. The relaxation or otherwise of restrictions is not absolute science. We cannot simply follow a formula. We consider public interest and make a decision, and we keep reviewing that. All the restrictions are valid for 14 days to enable us to keep reviewing the situation. And that itself is not easy, because soon as the new round is in place, we have to consider the next step. The factors are those that I mentioned at the beginning. First, the COVID situation. 2, acceptability of the public. In recent days, I've heard loud voices from businesses saying that they would like more relaxation. At the same time, I've heard from members of the public that the restrictions are too harsh. The third factor is the nature and risk of the event involved. Will it involve the taking off of masks? Will there be a physical interaction? Is it conducted in a confined space? For every relaxation, it comes with a tag. The organizer of the event, do they have the capacity and the ability to enforce the requirements we impose? That is a decision made by the Hong Kong SAR government, not by experts. Experts will give us advice. They will carry out inspections, research, tests, genome sequencing, and to find answers. But in the end, decisions are made by the Hong Kong SAR government, not by myself, but by us as a collective body. I've been explaining to you about the safety and efficacy of vaccination and its safety. I attach a lot of importance to the views and advice of experts, but in the end, it's the Hong Kong SAR government that make a decision, and we are held accountable to it. Well, let me say this. You always focus on 599G, that it targets marches. No, it is about gathering. If it is in an indoor venue with a confined area, then it's easier for the requirements and conditions to be met. The event organizer will find it easier to enforce them. But when it comes to those that are outdoors, well, you see gatherings happening at weekends at various places in Hong Kong. And it's something that we cannot regulate and control. The activities themselves carry a certain level of risk. And if we have to make a decision, it is a judgment. We do not target a particular activity. Thank you.